Hi, I'm Dr. Michael Herger from the Pandemic Mitigation Collaborative, and I'm here to tell you about how we're incorporating excess death statistics into our COVID-19 dashboard. I'll cover three facts in the video as a preview. First, I will show that in the US in 2025, we're experiencing 109,000 to 175,000 excess deaths from COVID. This translates to 2,100 to 3,400 per week on average. These deaths are on par with lung cancer, if not slightly higher. And we're incorporating this information into our dashboard. So let me walk you through it. Everybody should read this report. This is from Swiss Re, and they are a reinsurer, which means they insure insurance companies against catastrophic losses. Basically, the wisest people who could make this sort of calculation. They are a 161-year-old company worth $16 billion and have 15,000 employees. In 2024, they released a report on basically how insurance companies are underestimating deaths resulting from COVID-19, and this is causing a lot of problems for them. You can go read the full report at the tiny URL I provided, and I'm going to walk you through some of the highlights. In the report, they provide information for about a dozen countries. They provide the most information for the US, followed by the UK. And they outline the percentage of deaths that are excess deaths due to COVID across each of these years from 2023 through their projections for 2033. And for the US, they have two different scenarios. One is a more optimistic scenario, one's more pessimistic. For the optimistic scenario, they're saying that of the deaths that are occurring in the US in 2025, 1.3% of those are excess deaths from COVID-19 or deaths that, if COVID had not existed, we would not expect to happen. The more pessimistic scenario, the one I actually find to be a realistic scenario based on their description of it, is that we're actually seeing about 6% excess deaths. And they use percentages basically just to make sure that different countries are comparable, even though they have different sizes of populations. But I'll translate those percentages into what that actually means into death counts in the US. So they call these pessimistic and optimistic estimates. Their so-called optimistic scenario, I think, is dramatically over optimistic. I wonder if they're providing this optimistic scenario to kind of bring in people who are not really thinking about COVID as something that is still happening. And so they kind of juxtapose these two scenarios and then they explain why the more pessimistic one is actually the case. But in any event, the optimistic scenario doesn't really add up. They say, basically, if all of their estimates are wrong, you might get something like this. If cardiovascular disease resulting from COVID is not a problem, you could end up with something like this. But then they explain why cardiovascular disease is a huge problem from COVID. Um, if there are no healthcare workplace issues, you might get something optimistic. Of course, lots of issues in healthcare right now. And they say if there's more research going into improving medical care, medical science, that we could get at a more optimistic care. And of course, we're in the US anyway, we're cutting medical research funding dramatically, especially funding related to COVID and public health programs related to COVID. So optimistic scenario is quite overly optimistic in my view, but use it if you'd like. The pessimistic scenario I would actually describe as a realistic scenario. They say this will occur if we can continue to get new variants, which we do, if vaccine uptake continues to be a problem, which it is, and it's getting worse because a lot of the programs designed to help people get vaccinated or study how to counter resistance to vaccinations are seeing their funding cut. They say this is more likely to occur if cardiovascular disease is a problem from COVID and if it's likely to persist, and there's lots of good evidence for that, which they discuss in the report. They say this is more likely if healthcare systems struggle, and we know that healthcare systems struggle, especially when there are surges in COVID and flu transmission. And they say this scenario is more likely if the population continues to experience worse comorbidities. That is definitely true. The GLP-1 situation suggests that there could be some improvement there. So that's evidence is a little bit mixed. And they say this more likely if the economic challenges in the US persist. And of course, we're in a difficult economic situation at the moment right now. So if you look at these two sorts of models, Scenario A, the red model, to me, that's exactly how they describe it as what's happening. Scenario B seems very Pollyanna-ish, Denialville, maybe just designed to bring in people who aren't really thinking about any of this in 2025. And their own analysis basically says, yes, focus on this pessimistic scenario. They say these mortality problems are likely to exist for at least the next decade. They describe cardiovascular disease resulting from COVID as a huge issue, and they lay that out in a lot of detail, especially related to hypertension. And their main graph that is summarizing all these mediators between COVID and excess death is basically showing these factors going through 2033, not ending in 2028 like an optimistic sort of scenario. So to me, that their conclusion is pessimism. That said, there is a lot of minimizing sort of language in the report. They say things like during the pandemic, when many of us would agree that we're currently in a pandemic where we're seeing lots of excess COVID deaths, for example. They say things in passing like variants becoming milder. That's something you hear people say repeatedly, and then after the fact, we find out is not actually the case. They talk about endemicity. They talk about how surprising hypertension is as a consequence of COVID and all these cardiovascular issues that to me are not very surprising and that we've known about for a long time. So even in this context of coming from what I would view as kind of a mainstream minimizing sort of background, they're still saying that things are really, really bad. And that pessimistic scenario is true. And if anything, that would lead me to think that maybe their pessimistic scenario or realistic, as I would describe it, maybe it's even a little worse than that. But these cardiovascular issues we've known about for a long time. Dr. Claire Taylor is somebody that really, elevated attention to that, in my opinion. Um, and Science has published articles on that. So, and these posts are both from 2022, so it's not like this is some new surprising knowledge. So I reject the blue line, the scenario B. I think the scenario A, is reasonable. It could be mildly worse, but I'm not going to model anything based on that. And this middle ground sort of scenario to me is a more realistic, sort of optimistic scenario. So I'm basically going to work from those sorts of assumptions of the red and the orange line of what excess mortality is likely to look like in the near term. And so those are percentages that are designed to facilitate international comparisons of countries that have different sized populations. If you go look up the expected number of deaths in the number of deaths we're likely to have in 2025 from Our World in Data or other sources, it's about 3 million people a year. And you can use those figures and these percentages to go backwards and make backwards calculations of how many people that actually is. And so in 2025, we would expect something like 109,000 to 175,000 excess deaths or people dying that otherwise we would not have expected to die if COVID had never existed. And you could divide that up over a week or a month or whatever you want to, but over a week, that would be an average of 2,100 to 3,400 weekly excess COVID deaths in 2025. That is much higher than people realize. Um, when people hear there are 1,000 reported COVID deaths in a week, like at the height of a wave, that's something that really catches a lot of attention when it breaks that 1,000 mark. This is showing that on average, it's more like 2 to 3,000 a week. And that's just because we're not counting deaths as COVID. We're counting them as cardiovascular disease or dementia or cancer or something else when the causal factor is COVID that we can only determine based on complex modeling. So this just puts it in context because what does that even mean? 175,000 deaths a year resulting from COVID. The orange bar shows kind of the lower of the two estimates. The top of the red bar shows the 175. This is similar to, if not higher than, the annual deaths of lung cancer. In fact, if you use the high estimate of 175,000, that is about the same as if you combine lung cancer with any of the other types of cancer. I've got the top five cancers listed there. So lung plus colon and rectal cancer gets you to about 175,000 as well. So nobody would say to ignore lung cancer, that we're post lung cancer, post colorectal cancer, or that these are not problems, or that during lung cancer was sometime in the past. These are all ongoing issues that warrant a lot of attention societally. Okay, so we've got our two different models. We've got the number of excess deaths that I've just shown for 2025 and what those are likely to be for 2026, 2027. And so those are the number of deaths in each of those years attributable to COVID. What you could think about is if we knew nothing about infections, you could just take those deaths and divide it up across 52 weeks or 365 days of the year and just estimate how many people are dying of COVID each day or week or month. Um, if you knew something about COVID transmission, you could take the 175,000 and divide it by the number of infections per year and you could get a sense of per infection how many people are dying, and that could be something useful. That's a reasonable approach, but the 175,000 is the number of people dying in 2025. It is not the number of people who get COVID in 2025 and die as a result of it, because some of them will die in 2025, some will die in 2026, some of them will die in 2027. So if we want to estimate if you get COVID in 2025, what are your actual chances of dying? You've got to factor in that not all of these deaths are occurring this year. Some are going to be in 2026, some are 2027, some potentially later than that. Um, so the modeling gets a little bit complicated, but I think you can understand the idea of if you know the number of deaths, you estimate something about transmission, you can divide by one by the other, and you can get a sense of how transmission is related to daily deaths or weekly deaths or monthly deaths. And so this just kind of walks through what that sort of looks like. So we took the estimate of deaths attributable to COVID in 2025 and from 2025 infections. And so to do that, we took the death estimates for 2025 and we divided that by two, assuming that half the people that get infected this year would die this year. We assumed that a third of the people who get infected this year will die in 2026 when the case fatality ratio is estimated to be a little lower, and a sixth of those would die in 2027. And those fractions, the half, the third, the sixth, they don't matter much. And you could just use the 2025 values for everything, and you would end up with pretty similar numbers. And in fact, if the excess deaths from COVID remain flat and they don't go down at all, that would be a perfectly reasonable approach. Or that would give you an approach with just a little bit higher upper bound on your estimates. Um, but just to walk people through or a little more interest in the math. So you do that, you come up with a number of deaths resulting from 2025 infections. You come up with an estimate of 2025 infections, which we have really good data on that. You can listen to our 5-year pandemic anniversary video that's also on our website, and that just walks you through that. So that's easy to estimate how many infections we would expect this year or in a typical year around now. You can calculate the case fatality ratio or the chances that somebody would die of a 2025 COVID infection. And then you can use this information to indicate, based on the number of estimated infections for a day or a week or a month, how many people would be expected to die ultimately as a result of those infections. So really taking the infection data we have and putting it in context of what that may lead to in terms of death. And then we repeat this with the high and the low estimates that we're using for the excess mortality, those red and orange lines in our graphs. Okay, so we estimate that from 2025 infections, 167,000 people will die of COVID related to those infections as our upper estimate, and 100,000 as the lower estimate. Those are just a little bit lower than each of the values for how many people will die in 2025, because these are people get infected in 2025 and die sometimes later when their chances of dying are just marginally lower. So we can use that information to come up with the expected number of resulting deaths based on each week's infections or each month's infections. And based on the current levels where we're in kind of this high lull sort of phase, lull in a relative sense, but in an absolute sense, significant. We would expect the infections people are getting this week should result in something like a maximum of 1,400 excess deaths from COVID over the longer term, and that the infections people are getting during the next month may result in up to 7,100 deaths here in the US from COVID that otherwise would not happen if COVID did not exist. So I hope you find those statistics useful. You'll see those on the dashboard going forward. As a reminder, please take COVID very seriously, as these statistics show. Wear high quality, well-fitting masks, build an air purifier, test before gatherings, and keep on boosting. Thanks for listening.